Namaste. In our last discussion, we explored how our Indian diet and metabolic health, including sugar and weight, affect the health of our knees. But today, I want to address a question I hear almost every day in my clinic. Doctor, is this pain just because I'm getting old? We often dismiss knee pain as simple wear and tear, as if the joint is like a mechanical part that has completed its life. But modern medicine shows us something very different. Age-related joint pain is not passive, it is active. It is driven by a process called inflammaging. Inflammaging is like a slow burning fire inside your knee. It is powered by the accumulation of senescent cells, often called zombie cells. These are cells that have stopped functioning. They have retired, but they refuse to leave. Instead of helping, they release a toxic chemical soup called SASP, the senescence associated secretory phenotype. Let me give you a Chennai example. If one house in your neighborhood is neglected and full of garbage, the smell and the pests don't stay in that house. They disturb the entire street. Zombie cells behave the same way. They poison the healthy cells next to them. This is why you feel pain even while sitting still. This irritation triggers what we call the Alarmin cycle. Your joint sends out constant S.O.S signals telling the body that something is wrong. But because these zombie cells are still present, the alarm never switches off. This is why many of you struggle with daily activities, climbing the temple steps, sitting cross-legged for a meal, getting out of a car. It's not simply loss of cartilage. Your knee is stuck in a state of continuous internal alarm driven by senescence and inflammaging. And this is exactly why simple painkillers or generic steroid injections usually fail. They are like trying to put out a house fire with one bucket of water. They don't address the senescent cells or the alarmin loop. If your X-ray shows only mild arthritis but your pain is severe, you may have the inflammaging phenotype. Your biological age inside the joint is much older than your actual age. So, how do we cool this biological fire? We must change the environment inside the joint. We must calm the synovium, reduce SASP signals, and reset the internal alarm. Now that you have understood how inflammaging drives cartilage fatigue, synovial irritation, and persistent knee symptoms, the next logical question is, how do we intervene biologically? Not with quick fixes, but with treatments that actually modulate this dysfunctional metabolic environment. In the upcoming video, I'll walk you through the Orthobiologics landscape, PRP, BMAC, stromal cells, and next generation biologic strategies. So you can see how each interacts with the very metabolic processes we have discussed. This way, you will be equipped to evaluate which option has the biological depth to make a real difference. Before we move to orthobiologics, we need to address nerve-related pain. Many of the symptoms patients attribute to arthritis actually come from irritated or compressed nerves. Understanding this distinction will help you make sense of how and when orthobiologics are useful. So the next video in the series will focus on nerve pain. I am Dr. A.K. Venkatachalam. If a particular mechanism stood out to you today or something wasn't fully clear, drop a comment below. I use your questions to sharpen the next video.